Hi everyone, my name is Sarah Moss. Today I am presenting on healthcare compliance within Vanderbilt Imaging Services. I will explain how compliance works in the organization, why it is so important for patient safety and quality, and how it directly connects to malpractice risk and overall organizational performance. Organizational overview. Vanderbilt Imaging Services is an outpatient imaging network that provides services like MRI, CT, X-ray, ultrasound, and mammography across multiple clinic locations. Because it operates in a competitive outpatient network, patients have many choices. That means that the organization has to focus strongly on patient safety, accurate results, and a positive experience. Competition also pushes the organization to reduce errors and malpractice risks, since mistakes can quickly impact reputation and patient volume. Defining medical malpractice. Medical malpractice happens when a provider does not meet accepted standard of care, and that failure causes harm to a patient. In diagnostic imaging, a common example is a missed or delayed diagnosis due to incorrect interpretation of an image. From an administrative perspective, this is why compliance and quality systems are so important. Leaders need to make sure policies, training, and oversight are in place to reduce the chances of these errors happening. Governing bodies and oversight. Compliance is guided by multiple governing bodies. One major agency is CMS, which stands for Centers for Medicare and Medicaid Services. CMS is a federal agency that oversees Medicare and Medicaid programs, sets quality and safety standards, and controls reimbursement, meaning it affects how organizations get paid. Another key regulation is HIPAA, which stands for Health Insurance Portability and Accountability Act. HIPAA focuses on protecting patient information, also called Protected Health Information, or PHI. It does this by requiring organizations to follow strict privacy and security rules. State health departments also play a role through licensing and inspections. Together, these groups create expectations organizations must meet to avoid risk and maintain safe care. State versus federal enforcement. There is still an important difference between state and federal enforcement. Federal regulations, like those from CMS, apply across the country and are tied to funding and reimbursement. State regulations focus more on licensure, facility regulations, facility inspections, and daily operational compliance. For example, a state may inspect an imaging center to ensure equipment is safe and staff are properly credentialed. Both levels of enforcement matter because failure at either level can increase malpractice risk and lead to financial penalties or loss of accreditation. Free market and compliance pressure. In today's healthcare environment, free market pressure plays a big role in compliance. Patients compare providers based on reviews, wait times, and perceived quality. Because of this, organizations like Vanderbilt Imaging Services are pushed to go beyond just meeting the minimum standards. They work to exceed expectations by improving patient experience, accuracy, and safety. This helps them stay competitive and also reduce malpractice risk. Impact of noncompliance. Failure to comply with regulations can have serious consequences. Organizations may face government fines, lawsuits, and costly settlements. In addition, there is a loss of patient trust, which can reduce patient volume and revenue. Operational disruptions can also occur if corrective actions are required. Overall, noncompliance affects both financial health of the organization and its reputation within the community. Reducing noncompliance. Organizations use several strategies to reduce noncompliance. Standardized clinic protocols help ensure consistency in care. Ongoing staff trainings keep employees informed about policies and expectations, especially related to HIPAA and patient safety. Internal audits and documentation reviews help identify issues early before they escalate. Leadership oversight also plays a big role by reinforcing accountability and making sure compliance is a part of daily operations. Market consequences. In addition to regulatory penalties, the market itself responds to noncompliance. Patients may choose other providers if they perceive lower quality or safety concerns. Malpractice insurance premiums may increase. Negative reviews or public reporting scores can damage the organization's reputation. All of these factors reduce market share and make it harder to stay competitive. Monitoring and measuring compliance. Monitoring compliance is an ongoing process. Organizations use internal audits and risk assessments to evaluate performance. Incident reporting systems allow staff to report errors or near misses, which help identify trends. Quality metrics and public reporting also create transparency. These tools ensure that organization is continuously improving and maintaining high standards. At Vanderbilt Imaging Services, we specifically use the Veritas Incidents Reporting System. Staff awareness and communication. Leaders ensure staff understanding compliance through multiple methods. Ongoing training programs keep employees updated on policies and regulations like HIPAA. Regular communication from leadership reinforces expectations. Policies and procedures are made accessible so staff can reference them easily. In many cases, compliance is also tied to performance evaluations, which increases accountability and awareness. Risk management connection. Overall, compliance plays a key role in risk management. It helps improve patient safety, reduce legal exposure, and support quality improvement. In a competitive healthcare market, strong compliance programs also help avoid costly lawsuits, increased insurance premiums, and negative publicity. This allows the organization to maintain both financial stability and a strong reputation. Thank you.